postpartum advice as somebody who got pregnant at 13 and had my baby at 14. First, we're going to talk about the things that are normal and to expect. Your bleeding might get super heavy and then get super light and then get super heavy. It can take a while for your period to be regular again, and some people don't even get it for like the first 6 months. And if you're breastfeeding, sometimes it can be longer. You're gonna have a lot of cramping because your uterus is trying to go back to the normal size that it was. In the hospital, yes, they do press on your stomach. Even if you have a normal birth, not a C-section, they still press on your stomach and knead it, and that's to make sure that you're bleeding regularly and you're not bleeding too much. You're gonna have hair loss. The first month, mine wasn't as bad, and I feel like it just gradually gets worse. You're gonna sweat more, especially at night. That was the biggest thing for me, is I would sweat so bad. I kind of still do, but not as much. You're gonna have a lot of mood swings. You're gonna be very emotional, and I would say this is in the first like 2-ish weeks, because your emotions are trying to bounce back out because you just birthed the whole baby. Forgetfulness, and if you don't know what you call that, it's called mom brain. Your belly is still looking like you're a couple months pregnant, which that can take a while to go down. Mine's still not 100% down, but I was pretty much all baby. So once he was out, my belly kind of just immediately went down. But keep in mind, everybody's body is different. Constipation is the biggest thing, so please ask for a lot of stool softeners after you give birth. Because when I tell you that the first poop is the most terrifying thing in the whole entire world, I was so scared. It was at like 2 a.m, and I was texting my friend. She had already had her baby like 2.5 months ago, and I was like, please. I was like, please help. Acne or skin changes, because your hormones are trying to bounce back out and trying to normalize again. Like even now, sometimes I still get acne, but also keep in mind, acne is normal. Even if you aren't pregnant and you're not having a baby, acne is very normal. Back pain is a very big thing, because when I was pregnant, I had super bad back pain, and after birth it was like 10 times worse. And especially if you get the epidural, once your epidural wears off, it's just a weird feeling. Now we're going to talk about things that are not normal and when to contact your provider. Now we're going to talk about things that are not normal and to look out for, and when to contact your provider. If you're bleeding through a pad in less than an hour and it's soaked, please contact your provider. If you're passing blood clots that are larger than I think it's a golf ball, definitely contact your provider. Fever of 100.4 or higher, and if you're nauseous, getting dizzy, severe headaches while you have that fever, contact your provider. Swelling or redness in just one leg. I think we all know what discharge is for all the girls. I don't understand why I would be watching this, but if there is a bad smelling discharge, you need to contact your provider, because that can be a series of infections, and they're totally normal, especially after birth. I had an infection, and you just get on medication and it goes away. Also, if your discharge is weird colors. Intense pain that keeps getting worse instead of feeling better at all. And I'm talking about even with medication, it's not feeling better, because when you leave the hospital, they should send a prescription of Tylenol or ibuprofen or whatever to your pharmacy for you, and if it's not getting better with that, then contact your provider. And the last thing that I'm going to say is thoughts of hurting yourself, others, or your baby especially, please contact your provider. That can be very serious, and you can go on medication for it, and you will feel a lot better. Anyways, I love you guys. Bye!